Hello, my name is Stephen Cretney and I'm with the West Kootenay Climate Hub. Today, we're excited to feature doctors and nurses for Planetary Health, Kootenay Boundary. Several members will be speaking about initiatives that this very active group is working on. I'll pass it on to Judith Fearing, a local nurse in our area who is one of the co-founders of the group. She'll take it from here. Welcome, Judith.
Hi, my name is Judith Fearing. I'm a registered nurse. And as Stephen said, I'm one of the co-founders of Doctors and Nurses for Planetary Health, Kootenay Boundary, along with Dr. Kyle Merritt. I'm delighted to be here today. Thank you so much for inviting us. And I am going to share my screen and hoping that will all work out well. So I'm stuck on one slide here.
If you go to the bottom left corner, you should be able to reverse your slides.
Oh, I see. There we go. So I'm accompanied by three other members of our group today. Catherine Oldfield was a naturopathic doctor for many years and now is a nursing student at Selkirk College. She'll be following me. She'll be third. And the second person is Dr. Marion Barry, a neurologist in our area. She'll be after me, then Catherine, and then Dr. Lauren Galbraith, who's a family practitioner in Salmo and Nelson. So our group has been meeting for a couple of years. We've got about 180 people on our email list. We meet about every 2 weeks. We're connected with the Canadian Association of Nurses for the Environment, the Canadian Association of Physicians for the Environment, and West Coast Doctors for Planetary Health. And basically, we've expanded our scope of practice from individuals and community to the planet. And we're recognizing that our own human health and ecosystem health is completely dependent on the planetary health. So that is where our focus is. I love this slide. Is everybody seeing my slides okay? I can't hear anything.
They're looking great.
Okay, thank you. So I just really love this slide. This was presented at a UBC professional development conference on the climate emergency by one of the physicians there. And he showed this slide initially and said, it's not just greenhouse gases that is the problem and creating the climate emergency. It's our whole attitude to planetary health and human consumption and greed. So of course, the left slide is kind of where our focus has been with humans at the top. And the right hand picture is more of an indigenous view where we are kind of part of the entire system and we need to work together with the system. So just adding to the Indigenous acknowledgement, I want to acknowledge and show deep gratitude to the Indigenous people in this region and the Indigenous land defenders throughout the world for their perseverance in the face of enormous adversity and genocide to defend the earth, to show us that their traditional way of balancing human life and care for the earth is a way to reconnect and care for the planet. And that's what our DNPH group is doing, is trying to help people become more aware of this balance, always with the focus of health. So we're doing this through both mitigation of climate change, so working individually, amplifying the type of work we do, amplifying education, and through helping support local, provincial, and federal government policies so sort of from the top and the bottom. And what I hope for you to, what I hope to accomplish today is just recognizing that the Canadian Public Health Association views climate change as this century's greatest threat to health, and that healthcare providers work from a background of science and research. So when we hear that kind of thing and when we see the science, we can't unknow it. We now have to respond in the way that our backgrounds have brought us to. So the sort of 3 asks that I have when you leave is that if you're not already in a climate group, join one, and we'll have recommendations at the end. And if you are in one, could just continue, become more active. For people who are not already active, you are welcome to connect with one of us, to have coffee, to talk about how you might get involved. And at the end of the presentation, I have a little QR code to a Venn diagram by Dr. Anya Elizabeth Johnson, on how to find joy in climate action, because this is a long haul. We're going to be in here for doing this for the rest of our lives. And we need to find things that we really enjoy in order to keep this work up. So a little bit about how I got involved. This is me when I was little. I lived in England with my family. I had quite bad asthma, and I was always told that I just inherited that. But later on, especially in my nursing education, which was a long time ago, I learned more about the hazards of secondhand smoke and realized also that everybody in the household I had grown up in when I was younger, they all smoked pipes and cigarettes, and little was known about secondhand smoke in those days. So I thought, yes, it wasn't just inherited, it was also the environment. And it really has helped also to help me realize how much has changed since we learned more about the hazards of secondhand smoke. And it's inspirational to realize that, first of all, healthcare providers were the people that kind of blew the whistle on the tobacco industry, which had done a great deal to suppress the knowledge of the harms of tobacco to human health. In the same way, and it's the same playbook that the fossil fuel industry is using to suppress that knowledge that they've had for a long time, that that the greenhouse gases that are emitted by the fossil fuel industry are extremely hazardous to us. So when I think back, even in nursing school, all the doctors and nurses, we all smoked. We would walk around, doctors often did their rounds of the hospital with a cigarette in their hands, which is unimaginable now. So it's helpful to remember how far we have come when we look at the work that needs to be done. This has also come to light recently as we become more aware of the hazards of burning fossil gas in our homes, when we have gas stoves and even gas furnaces, knowing that there's leaks and stuff that occur with the methane gas. So, this is new information, and now we have to act on it. So our group has been acting on some of that, and we'll talk about that in a minute. But I think it's just more that I wanted you to think about the inspiration of how much has changed. Of course, I also realized that when I was a child, we had a gas stove as well. So I'm sure that added to my issue. So we're not going to watch that slide. So this is one of the other things that our group has done. Doctors for Planetary Health West Coast issued a code red for British Columbia with these 5 steps: declare climate emergency, take action on climate change, protect and restore nature, create broad transformative change focused on human well-being in balance with nature, and ensure a just transition. And this document, which has actions for each of those steps, was given to all the attempt was to give it to all the MLAs and provincial people. So here we are in the top left giving it to Brittany Anderson, and in the bottom right, Dr. Amy Radowski is giving it to Katrine Conroy. So the idea of all this always is to support other groups and amplify, get as much publicity about any work that you're doing, because that's how we draw attention to it. And this is our group at a rally we held in support of the Code Red document being given to by the West Coast Doctors Group at the legislature in Victoria. We did it here in Nelson, and we drew a lot of attention, and many healthcare providers had not been involved in doing this kind of action. So it was a way for our group to become more cohesive. But the then Mayor, John Dooley, was quite impressed, and it made him take note of what's going on, and why are these healthcare providers that out doing this kind of thing. Now I have, I'm hoping this will work. Oh, no. That's good.
This summer with the heat dome, the coroner just released a report saying there have been 595 deaths they can attribute directly to the heat dome. So that apparently is the biggest weather-related fatalities in Canadian history that's been recorded. And I'm not sure that it's being covered well enough or enough people realize all of the impacts that environmental degradation or climate change is having on human health. Working, of course, like a lot of us, with patients directly, we are starting to actually see the health effects of climate change on our patients now. It's not something that is going to happen in the future, but we're already witnessing it. And for me, at least, I was finding this more and more distressing and harder to cope with on a daily basis. So I think it's wonderful to see everybody here. There are more than 100 doctors, nurses, other healthcare folks outside of the legislature right now in Victoria. And so we're supporting them from Nelson here. And then you can think of us being part of that community of physicians and doctors and nurses in BC, and also think of us being part of a global community and think of all the healthcare folks that are out in Glasgow at COP26 right now, again, advocating for the same thing. This summer with the heat dome, the coroner just released a report saying there have been 595.
Now, I'm not quite sure how to get back. Do you have any ideas?
You should be able to click on the tab that the presentation was in, or hit back maybe if it's the same tab. Or stop sharing and start again.
Stop sharing and start again. Sorry about that, everybody.
No problem.
Oh, it goes back to the same one.
You should be able to advance to the next slide though by going. Oh, yeah, you have to find your presentation there.
No. Maybe you could bring it up, do you think?
Yes, just 1 second.
Sorry for that delay.
It looks like Judith is just in that tab just to the left of the one that you're in. If you go way up to the top, see it's highlighted on that tab that says doctors and nurses. Just
yeah.
Should
okay,
be.
great.
Oh, thank you so much. Okay, so this is one more thing that our group has done, or one of the members of the group has done. So we're not just talking about mitigation, but also about adaptation. So how do people, this poster was made and it's being revised each year, and it's like, how do people adapt to this? In this particular instance, it's to do with wildfire season. So when the air is very poor quality, first of all, people are getting monitors to measure it. And then just the idea that you need to stay indoors, it would be good to get an air filter, drink lots of water, and at least wear an N95 mask when you're outdoors. And so we are unfortunately expecting a hot and likely smoky summer. So this kind of thing will be really helpful. And then doctors, not just locally, but nationally, there's this campaign of how do we increase our resilience and our ability to withstand some of this difficult stuff. And one of them is prescribing nature. So this was actually shown that if you have 2 hours a week of being out in nature, and that could be like 30 minutes a day for several days, it actually reduces your cortisol levels and your stress levels and is really helpful in keeping you to be more resilient. So doctors are prescribing that. And then just being part of a support group is so helpful. And I find that I really enjoy being part of a group. I find it just makes me feel more inspired, and then it's a place to talk to other people about this difficult subject, because not everybody wants to talk about it, even though we need to be. So this is, of course, the West Kootenay Climate Hub, of which there are many members and organizations that are members. Neighbors United used to be also called the West Kootenay, what was it called? Eco Society. Yeah, and so that's them. And I just wanted to reiterate that these are the climate stripes. So each color, each stripe represents a year and the temperature of that year. So that's where we are, right at this crucial point where if we improve things, we'll go down and the world will get cooler. And that's what we need to happen. And if we don't get rid of reduce greenhouse gases, it's just going to get hotter. And unfortunately, there will be a lag time. So no matter all the work we're doing, which there's so much great work going on, even with all that work, it's probably still going to get a bit hotter for a while, but it will eventually it will cool down. So this work is super important. And one of the book that I'm enjoying the most lately is called Not Too Late, and it's a series of essays by journalists, scientists, and other thinkers. And one of them has written, this person is the Australian climate scientist, one of the authors of the IPCC report, Joelle Gurgis. And so she said, people often ask me, what is the single most important thing they can do to address the climate crisis? And her answer is, recognize you're living through the most profound moment in human history. Averting climate disaster is up to the people living right now. We have urgent decisions to make about how much will be lost to future generations. We must choose what we are willing to save. I think we'll skip Catherine Hayhoe and just because I know I'm running out of time, and just go to this critical decade. So, you know, we're already 3 years into this critical decade that in which we need to really reduce our emissions. But it is not too late because the emergency is not over. The outcome has not been decided. We are deciding it now. And I'll just end with the idea that, resilience, joining a group, and just the work that we're doing can be amplified more and more the more we talk about it, and not to let perfection get in the way of progress. My image for myself is that we're creating a critical mass, and then once we get more people involved, there will be exponential growth of action. So just to go back to the idea, and I think probably most of the people in this group are already part of a group, but join a group if you're not in one. Feel welcome to contact one of us to talk about what you could do, and consider looking at Dr. Anya Elizabeth Johnson's Venn diagram, which you can get from that QR code, because it will help guide you into what you could do next. So I'm going to finish there, and I would like to introduce Dr. Marion Berry, and she's a local neurologist, and she is going to tell you about the one of the committees of the hospital facilities engagement and the work that they are doing. And yeah, so thank you very much.
Thank you. And I'll be sharing screen.
Yeah, please would you do that? Okay. Thank you.
So thanks, Judith, and thanks, Laura, for inviting us. The facility engagement is part of the Hospital and Ministry of Health organization funded through the Doctors of BC. Next slide. And in 2021, Doctors and Nurses of Planetary Health joined forces with facility engagement to develop some strategies in mitigating climate change. So what is facility engagement? It's a group of physicians and midwives collaborating with administration to increase the voice of physicians and midwives and other medical staff, including nurses, to establish positive relationships and make positive changes in the hospital facility setting, strengthening the voice of physicians in trying to develop positive changes. Next slide. I've been a member of facility engagement since 2016 when it was first established. Last fall, I went to COP27, and next slide. One of the little areas in Sharm el-Sheikh in Egypt at COP27 was a hospital in Sharm el-Sheikh had a presentation, And next slide. They had a net zero hospital. So they had a brand new facility, and this is a little robot they use to bring patients in and also to dispose of medical garbage, which is a real big problem in the hospital setting. So next slide. So what is facility engagement doing? Judith may not have realized, but she's already shown some of the work that facility engagement did with the doctors and nurses of Planetary Health, and that's developing the strategy for fire, dealing with the fire season. So that was part of the Engage and Educate working group, and I'll describe a little bit more of their work next. We also worked towards developing a green hospital scorecard, and as a very strong difference from that hospital in Sharm el-Sheikh, I don't think any of the hospital facilities have thought much about their impact on climate change to date. Certainly at KLH, I can say that there's been very little thought given to the impact on carbon emissions. So there's recently, in the last 6 months, there's also been development of a planetary healthcare regional table. And the doctors and nurses, as I said earlier, developed strategies starting in September 2021. And then this work really started getting going in the spring of 2022. So it's just a recent collaboration. Next slide. So why is this so important? Many of you may not be aware, but hospitals are some of the least green sectors, and you can think about your own experience. And like Judith said earlier, compare that to what was happening decades ago, where things weren't disposed as routinely as they are now, and for good reason, to reduce infection. And you can even think about the last couple of years with COVID and the masks, and all of this is now in our waste. One of the largest contributors to greenhouse gases is the hospital and your healthcare. And just as an example, the healthcare impact on greenhouse gases is equivalent to the aviation industry. So people have stopped flying, and we may need to rethink what we're doing in the hospital system. Next slide. So this is one of the articles that facility engagements organizers presented, and identifying opportunities for greenhouse gas reductions and cost savings in hospitals, a knowledge translation tree. And from this model, there's some really easy things, low-lying fruit that can be implemented, and then more difficult and costly things that will take more time and effort. Next slide. So the Engage and Educate working group, again, Judith showed one of the posters that was developed related to staying healthy during wildfire season. There's also been education regarding anesthetic gases, and a large impact in our local hospital, where we've switched mainly to using gas that has less of a carbon footprint. And there's been 97% uptake with the anesthetists. And I think the remaining is really for specific indications where the anesthetic gas is required. Another big project that's been completed, Dr. Lee McKay was instrumental in this, developing, rethinking metered dose inhalers. And this has also been a province-wide education and initiation taken at different levels, and we'll be doing more work with that. But there has been some education trying to get physicians to switch to a puffer that has less of an impact. And just as an example, if you do use a puffer for asthma, if you do use a metered dose inhaler, if you use that 100 times, that's equivalent to taking a gas car on a 290-kilometer car journey. And there are alternatives that don't require the propellant that's used in the MDI. that are equally efficacious and don't have the same impact on the environment. So little changes and reducing waste in that example has been very important. Things that we're working on: active transport, a bike rack in the hospital, and then upcoming is developing more sustainable food practices at KLH. And we hope that that's going to be used as a pilot for a more interior health wide process. So next slide. So the next thing is the Planetary Health Regional Table. We've had 2 meetings with physicians from all over the interior health, which has been really exciting. We haven't accomplished a lot yet, but we certainly sparked enthusiasm for the physicians, and we're starting to do some pilot projects in Vernon. They're developing a hospital, in-hospital project to reduce the MDI, the meter dose inhaler puffers, to reduce waste and to develop more climate conscious practices. And from a presentation from someone in Vancouver Health Region, it's really incredible how much waste there is and how much can be done by just thinking about it. Nelson will be pitching a pilot project at our next meeting in June, so that's really exciting. And we can't say too much about that yet, but it has to do with food and food waste. And the goal is to develop more regional and systems change. So taking this from a local level and then developing more, I guess, impact on a more regional basis by banding together with physicians, nurses, and other healthcare practitioners. So this is really exciting work. Next slide. So other things that are happening, and again, Doctors and Nurses Planetary Health have been really instrumental in all of this. And Carl Merritt and Judith have worked hard on developing like a job description for, this is really super exciting. I can't say enough about it. They do have this in Vancouver, but we're hoping that in the interior health, there will be a high level physician doing medical leadership, thinking about all aspects of healthcare from a climate change perspective. And yesterday at the medical staff meeting, Judith, I mentioned that I think really we need to have nurses involved because of course you are so much better at organizing things. So I hope that that will happen in the future. Right now we do have green committees and green teams in the hospital. Unfortunately, interior health has not funded these positions, so the nurses are asked to kind of scrabble for time allotments, but hopefully in future this will be funded and there will be more presence of nurses involved in greening the hospital. Next slide. So again, what can we do? Patients can affect change. So these are a couple of ideas. Ask your doctor about the climate impact of prescriptions. So one of the low-lying fruit is actually not prescribing. So do you need your, pantoprazole for, regurgitation, or do you still need the gabapentin? Do you need the medication? Can you use a more climate-friendly inhaler? When you're admitted to hospital, ask if you can be on a planetary health diet. Then I'm not sure if it's appropriate, but most of the anesthetists are already aware about the anesthetic gases. You could talk about that. And just be aware that in the hospital, if you don't eat your food, and if you don't tell people that you don't want the food, say you're ordering from somewhere else in town, then that will all be in the landfill. So decline unwanted food. Next slide. I can't, yeah. And this is a picture from the Natobi Gardens in Vancouver on the UBC campus. And again, just re-emphasizing what Judith already said. Remember to get out in nature and look after yourself, your own health. Yeah, keep yourself healthy, happy, and walk in nature. And that's the end of my presentation. Thank you.
Thank you so much, Marian. And next we have Catherine Oldfield, and she's a nurse working in our group, nursing student working in our group, as I said before, and she's going to talk a little bit more about some of the work of the group.
Hi, everyone. Thanks for having me today. I'm going to share my screen. All right, how does that look from your end?
Very good.
Okay, good. So luckily, some of my presentation has already been touched upon by Judith and Marian, and so I can cruise through my slides a little bit faster. So I got involved in this work many years ago. I was a naturopathic physician in the States for 20 years before immigrating to Canada, where now I'm a nursing student. And so I was involved in many environmental groups, but really I found my footing most when I've been involved with groups that are allied with being a health practitioner. And so I've been involved with Doctors and Nurses for Planetary Health since its inception. And I just really think that as Judith mentioned and Marian's talked about, when we collaborate and work together, we can really amplify the message and I think have a larger impact. And so also doctors and nurses are the most trusted profession. And I knew that as a naturopathic doctor. I mean, I was able to speak with my patients about environmental issues and things like that, and they were very receptive to it. But as a nurse, it's a unique position where I'm, talking to hundreds and hundreds of clients, and it's like they're not seeking me out as a naturopathic doctor anymore, but rather I'm caring for them in the hospital or in the community. And so I think that I can be mindful that as a nurse, I'm very trusted, and then I can be part of a group that starts to do things like change the puffers or speak to our legislators or go to city council, things like that. And I'm also very passionate about things like food, of course. So I'm excited that the facilities engagement's talking about looking at the kind of food that's served at the hospital and how that can be more environmentally sensitive. So what is planetary health? Judith already touched upon this, and it's, just the recognition that the services that the planet provides, like clean air, clean water, and a stable climate are, similar to the life support systems that we have in our human body. And so we know that we have to decrease burning fossil fuels. We need to, reduce greenhouse gases if we want to impact both the health of the climate of the planet and human health. And, we're already seeing, unfortunately, the impacts of this in our region. We're seeing the wildfires, we had the heat dome, and we're having many clients and patients coming in with respiratory illnesses and other sequelae of the health impacts of the increased climate, increased temperatures. So one of the things I've done recently is, for example, Dr. Kyle Merritt from our DNPH group and I spoke to the Nelson City Council, and we were representing doctors and nurses for Planetary Health. And we talked about the impact of natural gas, of combusting natural gas in the home from our stoves and our furnaces and things like that. And one of the things is, what we're trying to do as doctors and nurses is we're not coming in claiming that we are climate scientists. Rather, we're looking at this through the lens of healthcare practitioners and focusing on this as how can we help our patients? So always looking at this through the lens of what is best for our patients and the planet. And that way, we're not claiming to be experts in fields that we're not. Rather, we're sticking in our lane of healthcare. And but our talk to the city council was well attended. The city councilors asked lots of good questions. The room was packed, and we were able to cover from from a really good standpoint, why it's important to phase out natural gas connections in the homes in Nelson to follow the step code that the city is adopting. And what was extra nice about that presentation was the fallout after, and the good fallout, it wasn't bad, meaning that there was an article in the paper about it. And then I started having friends and family members and neighbors text me and say, hey, I read this article in the paper, and my family and I started talking about it. We looked at our own gas stove, and we talked about, wow, we never run our fan. And it just led to lots and lots of conversations. And that's what we're talking about when we're talking about amplifying our message. And so it wasn't just that we presented to City Council in a closed room, rather our message got out into the community and encouraged lots of positive conversations. And so an example of, to show what we talked about in our presentation, a quick summary, is that we introduced, what is natural gas and how much of the natural gas, if not all of it, comes from fracking up north and the impacts on water and the environment. We showed that there's lots and lots of studies behind this. So we're not just making this information up. It's really important and it's science-based. We also just made analogies similar to Judith speaking about, that it used to be commonplace to smoke in the home and people were exposed to secondary smoke. Now that we're learning about the science of fossil fuels and natural gas, learning that we probably shouldn't be combusting natural gas in our homes with the stoves, and especially talking about the importance of ventilation. Most of us have insufficient fume hoods or only run it when the food smells bother us, rather than thinking about that we should vent the products of combustion out of our home. Kind of the analogy is that you wouldn't drive your car into your house and try to vent it out with a bathroom fan or something. And so we're just kind of educating people about the science. And, we covered the whys and hows and the specific problems with the indoor air pollution. And then Kyle showed this interesting slide, Dr. Merritt, of in his own kitchen. He had an air quality monitor and showed that when he ran his, turned on his stove, that the indoor air quality decreased. Of course, there was a big spike in pollution just in his household really quickly. And so those kind of slides, I think, make an impact on people. And then we introduced the idea that, of course, there's alternatives to burning fossil fuels in the home. There's an amazing electric technology right now that's safe, affordable, and clean. And so these are the kind of things that, as doctors and nurses for Planetary Health, we're doing in our community. Marian talked a lot about inhalers, and that's a kind of low-hanging fruit, as she mentioned. Just a second, let me find my slide here. And so inhalers, as she mentioned, are the MDIs, the meter dose inhalers, contain a potent greenhouse gas in the propellant, which is a hydrofluorocarbon. And so if we can change the prescribing habits of doctors, pharmacists, nurse practitioners, then we can actually hugely impact the greenhouse gas emissions of the hospitals or the healthcare sector. And they've already done this in plenty of other countries, and the alternatives with the dry powders are just as good, and patients adapt easily to them. But one thing that this has brought up for us is that, in thinking about this, is that it's one thing to talk to healthcare practitioners, pharmacists, nurse practitioners, and ask them to change their habits, and to ask patients to change their inhalers, or puffers, as we call them. But it's actually probably better if we influence future doctors, nurses, health practitioners, pharmacists, rather than trying to ask people to change their habits. Although that's still possible, we see this as another way that we can amplify our message. So in our group, we're talking a lot about how we can influence healthcare training. And for example, in the 2023 report that just came out about inhalers, sorry, let me find this quote. In the Journal of Canadian Family Physicians, said that primary care physicians can facilitate the uptake of these alternatives for the meter dose inhalers by also talking to their patients about environmental principles and treatment discussions, and advocate for the production of more sustainable inhalers. So if medical doctors and nurse practitioners and pharmacists learned in school that they should be talking about these things and understand the environmental impact, then from the very get-go, when they start practicing, this will just be commonplace that they'll prescribe these kinds of inhalers, or commonplace that they'll be asking those questions that Dr. Berry was mentioning about. Do we really need all these medications? Is there something more environmentally sustainable that we can switch to? So in our group right now, we're starting to try to target training programs. And Judith Fearing and I have started with Selkirk College. And so we've been giving presentations about climate change as a health issue. And in our talks, we're speaking about what I'm mentioning now, which is if we can influence people in their training, then they're more apt to carry through on those behaviors throughout their whole professional practice and all their years in practice. And they could influence thousands and thousands and thousands of patients, and they can, think of the difference they can make in all the thousands of prescriptions. But also we talk to students about resilience, because it's kind of like needing to be the person who uses the oxygen mask first on a plane if there's any in trouble. Healthcare practitioners are going to be listening to their patients' mental health concerns and stress from climate change, the many, many questions that are coming up, and then also dealing with the health impacts of climate change. And so medical students, nursing students, everybody needs to be prepared for this mentally and emotionally and understand that this is coming. It's not just a conjecture that they'll have to deal with the impacts of climate change, but rather it's happening now. So we're really advocating for changes in curriculum, and we'd like to make that a larger goal in our group. And so Judith and I have spoken to Selkirk College, to every year of the nursing program so far, first, second, and third years. And we have we've engaged some discussions and talking to the rural pre-med instructors about speaking there. And we're trying to figure out other programs we can speak to. That's all I wanted to talk about today. It was just to bring up this idea that healthcare practitioners have a huge impact. We're a trusted profession, and we can have the most influence if we amplify our message and take it on further, especially targeting schools and training programs. I think that's everything I wanted to cover. So thank you very much.
Thank you so much, Catherine. That was wonderful. And now we just have a few words from Dr. Lauren Galbraith, who's in her lunch break in Salmo. So she's just going to talk briefly about what she's also an active member of our group. So thank you, Galbraith, Lauren, for taking the time to do this, and we look forward to what you're going to say.
Thanks, Judith. Yeah, I won't take too much time because I think there's value in having a bit of a Q&A after this. But yeah, I guess my perspective is going to be more kind of a personal perspective, because I think Catherine, Judith, and Marion have all covered all of our kind of professional things really, really well. So I'm a family physician. I work in Nelson and in Salmo, and I've been practicing for 5 years. And I was born and raised in the Kootenays. And so I've definitely seen a change in my 35 years of being here with respect to weather pattern changes and that type of thing that we know is a direct result of the climate crisis. And so how I ended up getting into this work, I'm very new to this work. I only started becoming an advocate for the climate when our program or our group was started. So for about 2 years. And at that time I had just become a new mom. And I just very much remember the first time that my husband and I were able to get away from our little one and have a date. We both ended up in tears at the end of our dinner because we were talking about, oh my goodness, like what have we done? We brought a child into this world. Look at all the awful things happening. Like the heat dome had just happened. We were stuck inside. Yeah, it was anyway, so definitely some guilt and lots of different emotions, feeling hopeless, all of those things. And so luckily we had this group of doctors, nurses, allied health care professionals getting together because I didn't really know where to turn, and starting to work on all of this at kind of a systems level. So I think all of us are trying to do these little kind of personal gains, which I think, again, it contributes to us being resilient and being able to continue this work. And so just to touch on some of the things that I've personally been able to do, and again, I'm so privileged to be able to do these things, but one of my family's main goals was to travel less, so less air travel. During residency, when I was doing my training in Northern Alberta, I don't even want to think, I think I flew probably 20 times in 1 year. And so those were short haul flights, which we know is the most awful contributor to greenhouse gases. And so again, we've just made this goal to try to fly just once a year, which I try to do baby steps, knowing that we have family all across the country. But yeah, and then we also installed a heat pump in our house. We got rid of one of our gas vehicles. We participated in an electric vehicle share with Judith and her partner George, and we got an electric bike. We also got an induction stove. We're trying to get totally off of fossil fuels through the Greener Homes grants. And we're trying to eat more of a vegan diet. So anyway, all these just little things that we've been trying to do to feel hopeful about our contribution to climate advocacy. And again, through that, we've been able to have conversations with friends and loved ones and try to, again, amplify the message, because knowing that these individual actions don't necessarily make a huge impact. I think if you talk about what you're doing, and it's really amazing, some people are like, oh yeah, I'm already doing those things, or no, I've never even thought about that. I think, again, like all of the things I was going to cover professionally that we've been working on as a group have already been really well explained. I think kind of personal things that I've been trying to do as a physician is changing my prescribing habits, as both Marion and Catherine discussed, and then also as Catherine was alluding to, so just with learners that come through. So I teach medical students who are in our area for an entire year in their third year of medical school. And they typically come from all over the province, but yeah, just kind of letting them know about the different events that we're working on, and then they get to see me interacting with patients and bringing up the climate crisis and how that's impacting their health. For example, if someone who has COPD or emphysema comes in and they're having all these exacerbations in the summer, really linking it to the wildfire smoke and the negative impacts that can have on their health. I've also, I guess this is another personal point, been advocating with my child's daycare and amplifying that message through other daycares about when we are having these times where there's increased particulate matter in the air, that children should not be inside. And again, just reiterating, this is a direct impact of the climate crisis. And so hopefully through that, people are starting to think and hopefully being motivated to change. So that's all I have to discuss today. But thanks so much for having me, and thanks for all the work that everyone's already doing.
Thank you, Lauren. That was great. Thanks for sharing that. So thank you, everybody. And we'll be happy to talk or answer any questions. And please go ahead and ask us, or if there's anything in the chat.
Yeah, I don't see anything in the chat. But yeah, if anyone has a question, please feel free to either type it in now or raise your hand up.
Yeah, I'd like to say something about the lack of an enclosed bus shelter at the hospital. If you know anything about bus shelters in Nelson, I'm talking about Nelson now, most of them aren't in any way close to the adverse conditions of at the hospital, where it's wide open and there can be really lashing sub-zero winds hitting at people while waiting for a bus there. There used to be a bus shelter, but they took it away. And it seems to me that this group should advocate for a bus shelter. I've done everything I could to have one put there. The city of Nelson has flatly rejected an enclosed bus shelter at the hospital. And our MLA who has backed a bus shelter with, and speaking to me, addressing me in emails all this time, I asked them if they would please pressure the city of Nelson to put a bus shelter at the hospital. And they told me, well, they can't pressure. Now they just gave the city of Nelson $4 million. Now it seems to me that in most businesses, and we're talking about business here, business to business, most businesses, if somebody gives another business for support reasons, gives them a bunch of money, they have a say in how that money is going to be used. And I think that the MLA Anderson, in refusing to pressure the city of Nelson, I think it's scandalous that she refused to do that. So that's one aspect. And we know from experts that public transit is a chief area for fighting green gas emissions. So everything should be done to encourage public transit. And when it comes to intercity public transportation, we're in a very poor situation here in Nelson since Greyhound left.
All right, thank you, Phil. I'm gonna cut you off there just to say that is a very important a point here, and just wondering if Judith, if you can reply to that, if there's anything that your group or
yes, I'd like the group
be working on.
the doctors group,
Yeah.
so to fight
yeah.
for that.
You have brought up a very important issue. I totally agree that public transportation is hugely important. We know that transportation is one of the main sources of greenhouse gases in our area, that and heating public buildings or heating buildings altogether. So actually transportation is going to be, I think, one of the main focuses that our group is going to work on in our now. We sort of have laid to rest for a short time anyway, the fossil fuel in new builds. That was a big focus. And now we're going to look at transportation. And we will work with other community groups that are already working on that. So I hope that will change and we will have a covered bus shelter at the hospital, because I totally agree, it's ridiculous that we don't already have that. So thanks for bringing that up.
That's so good to hear, Judith. Thank you. Ron, did I see you put your hand up? Yeah.
Just in terms of the diagram that Judith shared with the interconnection of all things, I just finished reading Greta Thunberg's book, The Climate Book, and I mentioned to Judith it has a section on health, but from start to finish, it really covers the whole range of how everything is connected, from the grim facts. I was considering suicide after the first few bits, but it works through health, environment, water, and then into actions. And it really gives you a holistic picture of the interconnection of the problem. And there are 100 contributors, short little essays, but economists, philosophers, climate scientists, physicians, journalists. I'm going to bring my copy to the hub meeting on Saturday. I would recommend getting it. It's just over 400 pages, but quite inspiring and informative. That's all. Greta was going to give me 5% of sales.
Thanks, Ron. There was one question in the chat about what is meant by asking the hospital what a planetary health diet.
Marion, can you answer that?
Yeah, there was a study a few years ago that was largely put forward by public health in Harvard, and so there's a mainly what would be termed a flexitarian diet, where there's mainly vegetables, very little red meat, and sustainable food practices, appropriate, composting of food scraps. So it's very complex. And I emailed Laura a couple of references for that. So she can share that with people that are interested. And so it's not just one thing. And you don't have to be strictly vegan like I am to be optimizing your diet for planetary health. But it has to do with food practices that are more local and less heavily emphasizing particularly red meat, which is very heavy as far as impact on climate in particular. In a nutshell.
Well, and maybe if in our follow-up email, we could have that. Laura will share that.
Yeah.
Follow-up email with the recording. We are at time, so I am going to just send out a big thank you to Judith, Marion, Catherine, and Lauren for your presentations and for all the amazing work you're doing. And also thank you for all who joined us today. It would be great to see you all at the final webinar on June 16th, featuring the interdevelopmental goals and the -50%.org initiative. Hope you all have a great day and enjoy some of this heat before it really keeps up.
Thank you very much, everybody.
Bye-bye.
Bye-bye.